Hello, my name is Sierra Kaufman, and I would like to talk to you all about anxiety, which is a very overlooked disorder. Anxiety can be defined as a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Anxiety is the most common mental illness in the United States, and according to the Anxiety and Depression Association of America, 18% of the U.S. population from ages 18 and over suffer with anxiety. Of that 18%, only one-third receives treatment. Lots of people have anxiety. In fact, you wouldn't think that most of the people that you see day to day could suffer from it. For example, I am a stay-at-home mom. I am a full-time student. I'm a member of a huge family, and I enjoy spending time with friends. But I suffer with anxiety, and I've been diagnosed since I was in 6th grade. The first type of anxiety disorder that I would like to talk to you about is called generalized anxiety disorder. It can be defined as excessive or disproportionate anxiety about several aspects of life, such as work, relationships, or financial matters. According to Mayo Clinic, some of the symptoms of generalized anxiety disorder include the inability to get rid of concern, the inability to relax, the inability to concentrate, fatigue, headaches, and nausea, and there are many more symptoms that could go on that list. Generalized anxiety disorder can last up to 6 months before it is even diagnosed by a doctor. And once it is diagnosed, some of the treatments include psychotherapy and antidepressants, or a combination of the two. Some people are more anxious around big crowds of people or strangers. This type of anxiety is called social anxiety, and it is defined as a person who has excessive and unreasonable fear of social situations. Again, from Mayo Clinic, the symptoms of social anxiety include a feeling of being anxious around others or even strangers, excessive worrying before certain events that you know will have lots of people at, or even avoiding places where there will be lots of people. These symptoms can last for a very long time before it's even diagnosed, and it can keep you from attending a lot of social gatherings or keep you from being able to fully function at places like schools and work. The treatment for social anxiety disorder is, again, psychotherapy. You could also take medications such as anti-anxiety meds, antidepressants, or a combination of any of those. I'd like to talk to you about one more type of anxiety disorder, and this is known as panic disorders. Panic attacks can be defined as debilitating anxiety and fear that arises frequently and without reasonable cause. Some of these symptoms for panic attacks are much more severe than these first two anxiety disorders that I've talked about. From WebMD, the symptoms of panic attacks include attacks of fear, a feeling of being completely out of control in any situation, a pounding and or racing heart, excessive sweating, stomach pain such as nausea, and chest pain. These panic attacks can last up to 10 minutes and sometimes can last even longer than that. It's important when this does happen for you to consult a doctor so that you can properly be treated. Some of the treatments for panic attacks, again, include anti-anxiety meds, antidepressants, or a combination of the two in severe cases. Another form of treatment is cognitive behavior therapy. As you can see, people are left untreated very often because some of these symptoms from these disorders are similar to other illnesses or diseases, such as the nausea, headaches, excessive sweating, stomach pain. And it's very important for you to consult a doctor and be diagnosed and treated properly. I am proof that you can still live with anxiety and be in control of it and not feel like you're a victim of anxiety. You can still be able to live your life happily as long as you consult a doctor and get the treatment that you need. We now know some of the symptoms and the treatments for these anxiety disorders, and I'm hoping that if you have any of these symptoms, you take charge and are able to overcome this anxiety. Thank you all for listening.